Alright, here is your YouTube review for 6C on bone fractures and odds and ends. Hormonal regulation of bone growth at the epiphyseal plate. When you are a child, younger than you are now, and growing, that is regulated by growth hormone, otherwise known as GH. Stimulates activity at the epiphyseal plate, as it mentions here. How do I use a highlighter? I've done this a while. Epiphyseal plate activity is stimulated by growth hormone. When you hit puberty, the hormone that take over are the sex hormones. Testosterone in a male, estrogen in a female, and these finish up masculinizing or feminizing the skeleton. We certainly spoke about the differences in the pelvis bone. At the end of your teenagers, the epiphyseal plate, we say, closes when it ossifies and turns completely to bone, and at this stage, this point, you are done growing. What's referred to as bone deposition, in essence depositing the bone, which is accomplished by the osteoblasts, requires these cells. In addition, requires a healthy diet and 2 specific nutrients that are most important, I would say, are vitamin D and calcium. What's called bone resorption, sounds like reabsorption, is the job of the osteoclasts, the breakers. There's a number of words we used for the breakdown of the bone matrix by the osteoclasts. Digestion. I think I used the word, not the untechnical world, almost a melting of the matrix. Liquefaction, I spell that, liquefaction was also used. All these imply that the matrix, the calcium deposits, has been dissolved into soluble form. Soluble form, dissolved is another term here. This slide was eliminated. You got enough to learn? The bone fractures, you'll be given an x-ray of a bone fracture, certainly some other questions as well. 3 basic categories or 3 basic questions you need to be able to respond to in terms of looking at a bone fracture is, are the bone ends after the fracture still aligned or misaligned? This is referred to as a displaced fracture versus a non-displaced, if the bone ends are still in alignment. The completeness of the break, does the fracture go from one end of the bone to the other, or is it partially through the bone? If it goes all the way through, it's a complete fracture, versus if it doesn't, it's an incomplete fracture. And then has the bone ends penetrated the skin, as in a serious fracture, a la the Kevin Ware college basketball player type. If it penetrates the skin, it's a compound fracture, versus a simple fracture that breaks the bone but not the skin. And we can elaborate further on these points on the next few slides. So, a non-displaced fracture we have a fracture, but the one side of the bone and the other side of the bone are yet aligned. The tip I gave you was imagine down the middle of the bone. Imagine an imaginary line going through that axis, and keep it straight through the fracture. If on the other end it comes out also in the middle of the bone, then that fracture is non-displaced. versus a displaced fracture. Actually, did I make a fracture? I did make. So if we use that same trick, if I imagine a horizontal line and keep it on the same plane, we see how the bone has shifted out of alignment. This is a displaced fracture. We added some discussion here with a displaced fracture, and a displaced fracture requires intervention. This intervention by an orthopedist, by a doctor, by a medical professional is called reduction. There's two kinds of reduction. There is closed reduction. This is where, in essence, the doctor lays his hands on the person and aligns the bones himself, and then casts the fracture from there. So this is intervention without surgery. This would be where the alignment is not severe and where the bones are easily manipulated near the surface of the body. In a more serious fracture, potentially where there's multiple fragments, where the alignment is severe, where possibly a compound fracture that penetrates the skin, where surgery is required, this is called open reduction. In open reduction, there's surgery involved. With surgery. So this would be a more severely displaced fracture. I also mentioned in class where this would be you looking at the likelihood of pins or screws or some other extra hardware placed in with the bones to maintain the alignment, so when the bone heals, it heals properly. Nevertheless, whether it's closed reduction or open reduction, either one of those two is going to be required if you have a displaced fracture. A non-displaced fracture would not require what we call reduction. Although it certainly would potentially require a cast, it doesn't require this more dramatic intervention. All right, complete and incomplete are self-explanatory, I believe. If you can trace the fracture from one end of bone to the other, it's a complete fracture. If some white shines through, so to speak, on an x-ray, if the fracture starts on one end but doesn't penetrate all the way to the other end of the bone, it's an incomplete fracture. And okay, so we're using the word simple and compound to indicate whether the bone ends penetrate the skin. If you have a fracture where the fracture does not penetrate the skin, we're going to call that a simple fracture. If you have a fracture where the bone is jutting through the skin, this is a compound fracture. I like to think of it compound as in more than one, as in the bone has broken and the skin has been broken as well. All right, besides answering those three categorical questions for any fracture, there are some specific subtypes of fractures I would like you to know. Comminuted is where there are three or more fractures. So where you have multiple fragments, a serious fracture, and visible on the x-ray would be several cracks in the bone. You can think of that as a comminuted fracture. A spiral fracture, which is a jagged or ragged break in which the bone has been twisted, resulting in a snapping in two. Depression fracture I'm going to eliminate as one that you're required to know. I'm also eliminating compression. These two you need to be careful of because they are similar. They're both in the area of the between the epiphysis and the diaphysis. An epiphyseal fracture is almost always a complete fracture. The epiphysis separates, therefore a complete fracture that occurs at that location. A green stick fracture, by definition, is an incomplete fracture, where in essence one side of usually the epiphysis is dangling a bit due to the nature of the incomplete fracture. This happens in children. Again, both these occur at the area where the bone is not completely compact bone, not completely spongy bone, sometimes cartilage in the area of the epiphyseal plate. We'll see these on x-rays here. You can see here in the area of the ankle, there's multiple fractures. There's a little fragment here, there's a crack here, another crack here. So this is a comminuted fracture. This is, you would say, is a displaced fracture. If it's displaced even a millimeter from its normal outline, from the normal line of the bone, then it's a displaced fracture. This is a complete fracture. You have multiple fragments. And in appearance, which is a judgment call based on an x-ray because you can't see the skin on an x-ray, I would say this is a simple fracture. Compression we're eliminating. A spiral fracture is pretty obvious in its presentation. You can see how this is the tibia. You can see how it starts out high on the one end and comes down raggedly through the bone out the other side. You can see this is a displaced fracture. It's a complete fracture, as it almost always is. And again, based on the degree of displacement, my judgment would say this is a simple fracture. If we look at the epiphyseal fracture, I think of a bowling pin almost that has been knocked over. You can see the tip of the epiphysis left here. This is a displaced fracture, obviously. This is a complete fracture, as it almost always is. And based on the degree, if you look carefully here, you can see the outline of I believe, the muscle here. And based on the degree of displacement, I would call this likely a compound fracture that has broken the skin. And we're eliminating depression and green stick fracture here. This is one place we can use. Again, it is clearly displaced. Again, this one is clear, but if you're not sure, again, if you follow the dotted line here, obviously the bone has bent out of angle. So this is a displaced fracture over here, the green stick. By definition, a green stick is an incomplete fracture. And based on its degree of curvature and that the bone has broken and curved inward, not outward, I would say likely a simple fracture, in which case the skin is not broken. Again, based on my judgment and my decision, these 4 slides on how a bone heals a fracture. Which leaves us with 2 slides on 2 bone diseases. This one is rickets. It's due to an inadequate diet, insufficient diet, and we're looking at those 2 main nutrients needed to help the osteoblasts lay down bone, which is calcium and vitamin D. There is a picture on Google Classroom available, and what you can see in the leg bones of someone with rickets, unlike a healthy person in which the bones are straight due to the weakness in the bone under the weight of someone standing, the leg bones bend, or what we call bow. So you get bowed legs. And this is going to happen in the child as they develop if their diet is not sufficient nutrients. and osteoporosis, which is common in the aged, more commonly in women, where it's a hormonal. The cause is mostly hormonal. So bone resorption outpaces bone deposition. So what we have is osteoclasts, that's an O, are outworking the osteoblasts. And this is treated with usually calcium supplements. All right, good luck.